I feel so I was born in the 80s and I know that I should be super into tech and super versed in this, but I'm not. I've chosen
Well,
a
you probably
profession.
have your areas where you super
Sure,
versed.
yes, I'm very comfortable in a kitchen. It's what I studied and so I'm comfortable there and standing all day is fine, but this stuff I get very Okay, so I wanted to start. First of all, thank you. You really could be anywhere else, and you've given some time to, like I say, a mom, who has her origin story of how I came to be interested in oral health. And yes, I appreciate your time. I appreciate anybody's time that shares with me. And what's happened over the course of the last year or so is that I want to help people kind of apply the information that I've learned, obviously in conjunction with the proper physicians and the proper help, to get people kind of on the right course. So I know you're a dentist, and but let some of my listeners in on what's been your background. How did you become interested in dentistry? How did it shift into a more integrative, holistic dentistry, and where you are today with that?
Well, it all started already at university because at university we need to do all the things that we later on do with our patients. And so just coming from high school, having had chemistry and learned that mercury is the most toxic material on planet Earth, most toxic non-radiating material. And then at university, we learn, well, if it's combined with some other materials plugged into your mouth, then it's absolutely fine. So that was a bit of a kind of question mark. Is this really, really true? So I started already then to question these things, looked into homeopathy, kinesiology, and so one course led to the next, and you meet people, they have experienced different techniques, different diagnostic tools. And so yeah, then you just broaden your knowledge over time. And when I left university, it was absolutely clear that I will not touch amalgam anymore because it's just such an evil material that can cause so much havoc to people's health. And if we have time, I can share one of my first stories I had with amalgam. It was extraordinary. And so, yeah, then it led me to more inquisition. What else is going on in dentistry? I looked into root canals, for example. I came across this fantastic book of George Meinig, Dr. George Meinig, Root Canal Covered Up.
Mm.
And that was really funny because two weeks before I came onto this book, we hosted a course in our clinic about the best way to do root canal treatments. And so we're all about buying microscopes and the latest gear to do that really, really good. And once I read that, I said, sorry, no more root canals for me.
Yeah.
So, and that was back in 91 or 92. And then we discovered mechanisms, ways to help patients detox, to help them supplement. And the main thing really is that you take responsibility for your health.
Hmm.
It's it's the same thing whether you go to the doctor, to the dentist, to the lawyer. You need to know your stuff in some ways. You need to know what kind of questions you need to ask so that you're well informed. Because only if you have the knowledge you can make a really good decision.
Yes.
And I think this is the main thing. This is why I do all my podcasts, why I wrote the books, so that the knowledge really gets out. People can look up, can read it, can listen to it, and then they get more knowledgeable. And as you know, if you get more knowledgeable, you can ask different questions.
Yes. Yes.
And so when you then sit in the chair opposite your dentist, you will then want to know, well, what kind of composites do you use? What are the ingredients in these composites? And why do you use the fluoride in it? And so you can have a real good conversation on equal levels. Although from experience, what I've heard from a lot of patients is if they become too inquisitive, the doctors, dentists, they don't really like
Right,
that
right.
because they feel
Um,
threatened. I mean,
yes,
in the end, we're kind of brainwashed at university, if you want to look at it this way. We know these things, we are told you do it this way. And if you don't keep looking on further beyond your box, you stick with that. You become very comfortable, you become very good in what you're doing. And why should you change?
right.
And it's
I
only when you really look at the whole person that you then see, wait a moment, dentistry is a real big part of medicine. It's not an outsider thing that we don't really need. Oh yeah, well, drill, fill, and bill a few holes. No, dentistry is at the center of health, really is.
Yes, the origin to develop on that story for me, my daughter falls at the park and develops a very tiny lesion. And in fact, I'm grateful when I took her to the dentist, very simple, straightforward appointment. She says, okay, don't let it turn into a cavity. And I was thinking about it before talking to you. I'm actually very grateful that she gave me that response because the chain reaction that happened in me was, okay, I need to find out everything I have to know in order to achieve that.
Yes,
And so
yes,
the it's curious in two ways right now because so I've since then I've developed this kind of internal fantasy of there being a fully dedicated university to these integrative practices. And then I'm older, and so I don't necessarily I perceive I don't have the time to go to school for dentistry to then go to the holistic approach and kind of unlearn everything that I would be taught in a traditional dentistry school. So I feel like perhaps, and it's curious. That was my last question for you. I was like, okay, what are you excited for? What are the possibilities in doing this? So that's one piece. I fantasize with learning all of the exciting stuff and not having to deal with the rules. I'm sure it has their place when necessary. And then, yeah, I want to teach parents how they can, after they have all of the tools at their disposal and all of the information at their disposal, to observe their child and say, okay, the issue that is presenting is X, Y, or Z. Let's do this combination of either some herbal remedies, some tinctures, or let's get physically adjusted at the chiropractor or with an osteopath or cranial sacral to kind of adjust, to set course for the body to
yes.
heal itself. So how does an appointment with you as the integrative holistic, that way of approaching dentistry, how does it look like with you? And I want to present two cases. So someone like me who doesn't necessarily have something chronic or acute going on, but I like to stay on top of things or I like to be ahead of anything. And then the parent that, for example, has a 4-year-old, comes with a cavity, has some eczema, has some behavioral issues. How do you view that person? How do you address those issues from an oral perspective point, obviously?
Well, every patient receives our very extensive questionnaire. So then this gives us already an idea of where they're coming from, their medical history, what they were suffering, their symptoms over the last 3 to 6 months in terms of gut health, mental health, digestive, lungs, liver, blood tests, surgeries they had, vaccinations they had. So it's a very long questionnaire where we really get an idea of who will be sitting opposite us when they come for their initial consultation. And we also offer online consultations for patients who are from abroad or from further afield so that we get to know each other. And when they then come, we already know kind of what we need to do. And we then allocate a bit more time so that we can already start the treatment. So what's different when patients then come to us? Well, we look at our clients from really top to toe. So first of all, obviously, the mouth, how do the teeth bite? How do they move left, right, forwards, backwards? We take a big x-ray to check the sinuses, the bone level, the TMJ joints. These are those joints here. We see if there is recession in the jawbone. We see if there are areas where teeth have been removed, if that looks okay. Also, we have to say that X-rays can be a bit deceiving. They don't show all the time everything. So we have different tools to mitigate that. And we also look, how do the patient breathe? Where have they got their tongue located? Is there a tongue tie? Is there a lip tie? Especially important with little kids, but also for adults. If they have a tongue tie, they can't position their tongue in the right way. And so therefore, they might start sleeping with the mouth open. They snore, so they're not really relaxed in the morning. We also look at leg length differences, and that's quite fascinating because a lot of the times you see when the mouth is open, the legs are in the same length, and then you let them close their mouth, walk for a few meters, lie back, and all of a sudden the legs are in a different length. So that is a prime example and a very fantastic example to show the patient what influence we have here that really goes down to the shoulders, to the hips, and to the legs. And we also then let the patient explain why they came to us, why they choose the holistic route, what's important for them, what do they want, what's their goal with that treatment, with that examination. And so we create a common theme, what they want, and we then give offers, options, what we can do, so that you really get the information, the pros, the cons, and you also get this in writing so that every single tooth that needs treatment has the according description and the fee involved. And with the kids,
sorry.
with the kids, it's very important that we look exactly at the myofunctional area in the mouth. So how do they breathe? Have they been breastfed? How have they been breastfed? Where's the tongue positioned? Because a lot of people don't really appreciate that the breastfeeding is not just giving the child a really good start into life. It helps them to develop proper breathing, proper swallowing, and by taking the nipple into your or into their mouth and pressing with the tongue the nipple to the palate is an essential part of the development of their palate. So this gives really reaction to the palate so that the palate knows, I need to grow, I need to grow. And if you have only got the bottle fed kids, I mean, when they drink out of the bottle, they almost drown, and they don't have this physical stimulation from the tongue, the nipple, and the palate, which is so important. So we then recreate this by myofunctional exercises, myofunctional appliances, that they really use the time from when they are 4, 5, 6 years old to 12, 13, 14 to really develop the jawbone. That might need some cranial osteopathic treatment, some chiropractor treatment, maybe even some speech and swallowing practice so that they relearn how to do it properly. And the big advantage is that when the parents bring their kids that early, we look into habits so we can stop the habits, start the process of developing the jawbone. And this is in opposition to how orthodontics conventionally
would
are
address that, yeah.
dealt with, because the dentist then says, oh, well, yeah, I see it's a bit crowded, but wait until they're 12, 13 years old. We go for that then.
Mm,
You come back with your child, it's 12, 13 years old, and then you're told, well, now we have to take 4 healthy teeth out because we need to create space.
right,
Well, first of all, you don't create space if you take the teeth out, because that space is used to bring the rest of the teeth together. So in the end, you have an even smaller mouth.
right, right.
And by starting early, 5, 6, 7 years old, you use the growth and help the child to avoid those rather traumatic orthodontic treatments. You have,
Um, I have a
by a long
question.
time, this influence.
Out of curiosity, the mother, which I understand from a holistic, functional perspective, if the mother's milk hasn't come down, there's a bigger story to that, but let's just say we're here, our milk hasn't come down. What can, if anything, what can be done with the baby to help with the oral cavity formation? And for example, I have read, I understand that you want to stay away from the bottles, as you said, for the oral cavity formation, for the proper airflow development. But let's just say you didn't have a recourse. You can't take them to the orthodontist when they're a baby, right? Before they're a year or two old. Is there anything that exists that you could do with a baby?
Well, there are actually some kind of tips on bottles that, in a way, pretend to be like a nipple. So it
Mhm.
makes it more, yeah, harder to get the milk out. So that is
Okay.
one way of doing that. Or what you could do with just a finger, just prod the area, the palate,
Mhm.
multiple times during the day, so that you give the information that the child would normally get.
I would love to see that. In my case, like I said, I didn't have any issues with breastfeeding. But I would love to see a product that marries myofunctional effects with usability in terms of, nipples and toys.
Yes,
Yeah, that would be awesome. So I do you have children? I didn't want to presume that you had.
I have 3.
Wonderful. So I love to, especially in speaking to dentists, how was your routine with your children and growing up with them? Did you make it fun? What are some tips that parents can use? And that's my focus. My focus are younger kids. How can we, or how was yours? Will you share with us what you did with your children that maybe they were into, maybe they're not into, but that was effective for you in your results?
I think the main theme here is really that kids always want to do what the parents do. So
Mm,
we are their idols, we are their role models. And so if we do something and we have fun with it, they want to do it. So you give them the toothbrush and you give the toothpaste. And yes, it's messy sometimes, but as long as they have fun and they enjoy, and over time they will realize that is a really good thing to do. And if mom and dad are doing it, it can only be good. And so the teeth are looking good, the teeth are looking healthy, and they will then over time understand why it's so important to do that. And you can then bring in the nutrition, you can bring in snacks and all these kind of things. And yeah, the importance really is that it's fun, that it's not a chore and get up and do it, and but to keep it light-hearted. It's not always possible because sometimes they just don't want to do it,
right.
and then it needs a little bit of a more sound approach. However, I think if we educate our kids in that way in other areas, they're so used to just copying us.
Right. Right. Mm.
I mean, there's a very big thing that I always like to add, and that is even before parents want to or think about kids, that they start detoxing, that they get their amalgams removed, that they get their mercury out of the body, because nothing better for a mom than becoming pregnant to detox their her stuff into the little one.
Right,
And that's the
right.
reason why we see so many patients, little patients, kids that have mercury intoxications without having any mercury in their mouth. All comes from mom or obviously from vaccinations.
Yeah, I
So
don't
it's
know if it's legal still in the UK, but I found out earlier this week the US still does mercury fillings for children. I did not know that. That is a shock to me.
but there's a big movement going on, and in most countries, if they still use it, they don't use it for kids, for pregnant women, for people who have kidney problems. Now you need to ask yourself, if it's not good for them, why is it good for us?
Right, right,
So again, a lot of things don't really make sense if you look a bit closely.
correct.
And so we come back to, yeah, take responsibility, ask questions.
Yes. And then in your, again, my focus is parents and children and just giving everything for them to understand the panoramic view, right? That's what I call it. The panoramic view.
Yes.
How can we see everything? How do we keep our children healthy and supported in what I feel is a ever increasing toxic world? What in your eyes, with your wisdom, what would you keep kind of in the front of your mind versus at the back in that and in yeah, and supporting them in their growing bodies and yeah, what questions do you ask is important to know, but also how to think is important, right? And even it so for me, this whole dentistry was new. um it is not taught in any way that is useful in people's lives. I think in school it's okay, brush, floss twice a day, and that's kind of the end of it. And then we're shocked when we go to our appointments and we find there are bigger issues. So there was and as long as I stayed interested, which I have been up until now, I'm amazed at everything that I hear. So when I hear gum disease is an expression of a systemic disease, when you read things like that, your immune system is compromised or it's suppressed, and things that don't seemingly appear related are. And so that's the kind of, yeah, how do we support our children in this ever increasingly toxic world? And how do we approach when we see an issue with our children?
Well, it's all about lifestyle. So, what do we start feeding them when they get off the breast or off the bottle? And I think it's important that we give our kids something to chew, where they can properly chew and not just mash or liquid, because the chewing will again help the development, help the digestion. So that is one part. And if possible, look for food that is organically grown. Now, there's quite some controversy. Some people say it's vegan, it's vegetarian, or others are carnivores. Now, I think, and I've done a vegan diet for a few weeks, and I looked worse than I ever looked. So I know for me, meat is
Excellent.
very
Yeah.
good. I
Mm-hmm.
strive on meat. And we have quite a few patients who've been vegetarian or vegan for 5, 6 years, and they don't look good. Their gums are not okay. So if you do a diet like that, which eliminates a lot of minerals and vitamins, it's important, again, you take responsibility and know what you're doing so that you can then add what you're missing out if you don't eat meat or if you don't eat vegetables, so that you know what needs to be added to your daily routine. And again, we parents are role models. What we eat, the little ones eat. And it's very important at the beginning of the external feeding that we keep it very low with sugar. Whatever we do, sugar, it's not the sugar per se that's the problem, but what the sugar does in our gut. And so this is a very big issue, because a lot of the times parents give something sweet so that the kids are quiet and they do their things and parents can do theirs. So again, it's the parents' responsibility to educate the kids in a playful way and give them to eat what's really nurturing, what's really helpful and supportive. So when it then comes to brushing teeth, we've dealt with that. Again, you're the role model, you show what you do, and obviously you look for toothpaste that have no fluoride and no other harsh nasties.
Mm.
And then the kids have a really good chance of growing up in a very good way. Now, what we integrated in the practice a couple of years ago is that we also look at underlying issues like blocked emotions. And especially when it comes to surgical treatments, this is very, very important because we want to have the energy flow in the area where we do the treatment so that we get a really good healing. And since we do that, and after 5, 6 months do an ultrasound to check the bone density, it's absolutely brilliant how bone density has developed and it looks very, very healthy. Also, on top of that, we uncover emotions that are blocked that people aren't aware of because they're in the subconscious. And for some patients, this is life changing. It's an absolute fantastic way of integrating this into dentistry. And this is what makes our approach really holistic.
I love the ripple effect that that can have.
Yes.
That's powerful. I in my research and in my putting together the synthesizing of this, I obviously I found your podcast and I love the episode on light kinesiology and then
Yes.
on your website the biophoton, and I was like, this is incredible. But I need to focus. In my case, I feel I do a pretty good job in feeding my daughter well. To your point, to the carnivore or vegan, I feel that humans are at the top of the food chain because we figured out a few things, and cows have to eat the grass all day to get some sort of concentration of the vitamin K, right, or of the vitamin D
Yep.
or A, and so for me, it's very logical. Okay, we need to eat liver because of the vitamin A. We want to absorb it with some fat, so on and so forth. I've put together the information, and for me, it's very simple. But I also find that I don't know why it's so hard to transmit that. You tell people, okay, just don't drink the fluoridated water, don't consume the chemicals, and you will be fine. You will see improvements. Um, and I think you mentioned that piece of responsibility and asking the right questions, and yeah, so it's lovely. It's lovely. Yeah, I enjoyed it. I enjoy your podcast thoroughly.
I think
And
it's also very important that when it comes to the vegetarian vegan, a lot of the times we hear this ethic argument that I don't want to kill an animal. And I'm absolutely with these people. However, when grains are harvested, and most of the time it's monocultural, so it's miles and miles of the grains, and the amount of little animals and not so little animals that are killed in that process probably goes into the millions.
correct. Yes.
So we then need to really put that into relation. A cow that feeds how many people, and this is one animal, and then you kill millions of tiny little ones. And if we want to put it even further and say that everything on planet Earth is a living being, has a soul, has an intention here, then you kill grass, you kill grain. So
Mm. And
where do we stop? How
and you
can we
disrupt
balance?
you
Yeah.
disrupt the microorganism, the balance in those monocultures, industrialized food products. Yeah, I agree. I share your sentiment. Definitely.
And I think it's very important whether I'm vegan, vegetarian, or carnivore, that what we eat is really well fair. So I would never eat a chicken that comes from a factory farm or cows. I want grass-fed, grass-finished, so
Yes.
that I know that they really have been treated well, and this will then be in their meat. So I
Mhm.
don't have that adrenaline rush. I don't have any antibiotics, any fast growing things. There are cows that do hundreds of liters of milk a day. I mean, this is not normal. That's not good.
Right.
It can't be good for us then if we consume that. So again, here we need to take responsibility. What is it that we want to achieve? And only if I feed a motor with good fuel, then the engine runs well.
Mm. Okay, so what excites you for 2024? What is your vision for the year? I know you are going into education, right? It seems like you've pulled a bit back and are going to go into that field.
Yeah,
Is
together
there,
with some other doctors and practitioners, we're looking into establishing a education on university level so that lay people can join, do seminars and get educated. So whether they use it for themselves, for their family, or even if they want to pursue a profession with that. So this is one thing. And the other part is that we want to expand. We're looking for one or two new dentists that want to join us. It's quite hard to find young dentists who want to break out of the normal system. So yeah, it will be interesting what 2024 brings. I'm very excited because there's always new things that you can discover there, new patients that bring new ideas, and so I'm really looking forward to 2024.
lovely, lovely. And then in your parting words, um, why is there wisdom in teeth? Why should we consider the teeth first in terms of overall health? Um, and again, in that lens of the young mother who, in my case, I'm excited. I think I've done my job with my daughter's lesion. Um, I am very willing and in disposition of supporting her. So maybe that in between, yeah, the younger mother who has everything to look forward to, why should she think of the wisdom in teeth?
Because teeth are connected to organs. So if we look back into the Chinese medicine and we then apply the meridian theory to teeth, every tooth has an organ connected to it. So the front teeth, for example, upper and lower, are connected to the kidneys, to the urogenital system. So we know if something goes awry in the kidneys, for example, that can then show in the teeth. So not all tooth problems are tooth related. They could just be signals
Mm.
from some other areas of the body showing, hello, look, listen, or the other way around when we have, for example, a dead tooth, an affected, infected, abscess tooth, that could also then affect the organ that is connected with it. And with the organ connection comes the emotional connection. And with the emotional connection comes the brain connection. So we find all those different organs, emotions in the brain. They have certain areas, and by combining the light kinesiology with Dr. Bradley Nelson's emotion code and Gerdrike Hamer's German New Medicine, this gives a fantastic protocol to apply and to look really deep into a person's not just physical body, but also emotional and spiritual. And this is where healing is actually starting, and where also, from my perspective, from my experience, where health starts and where disease starts.
It's an exciting, it's exciting. I find it's exciting because it's very simple in that there is a solution. It's not this
Yeah.
very convoluted or complex situation. It takes time. And so I think that when you have an acute problem, you're worried and you should pay attention to it, and it could take time to resolve, but that's it. I mean, outside of that, it sounds like everything is relatively straightforward. We need to address the entirety of the issues.
Yeah, and we also need to see that whatever we experience with our body, that we created that, and that our body is there to show us something, to push us in the right direction. Because everything that happens with us, to us, however we want to see it, is our
For us,
creation.
yeah. Hmm.
And if we get that, that makes life much, much easier.
Beautiful, beautiful. Thank you for your time, Dr. Young.
It
Uh,
was a pleasure. Thank you.
yes, yes. May it happen again.
Yes,
Um,
absolutely.
yes, yes. So thank you for being on the Rooted Remedies podcast. Um, Lovely, 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 lovely.
Yeah, and if your listeners want to know more, there's so much information on our website with the podcast. They're freely accessible.
Yes.
So they can already start there to get more knowledge, or if they have an appointment coming up for a certain kind of treatment, listen to the podcast, get an idea. So yeah,
Yes, you've written two books, correct?
yes.
Which are the two books? Should people want to look that up?
One is Shut Your Mouth and Open Wide. That's really good. Gives an total approach how I see holistic dentistry, is written in a way that you can just read a page or two, and is rather entertaining, some say frightening. It's a really good way of getting to know holistic dentistry a little bit more from many different angles, and it also shows what else is actually impacting oral health, whether that's breathing, proper chewing, our mindset. These are all things that come together. And so yeah, Shut Your Mouth and Open Wide. I think it's still available on Amazon, or you send an email to us, go on the website, you can buy it on our web shop. So
And the second book?
yeah. And the second book is that I wrote together with a couple of other practitioners. It's about wellness,
Mm.
where I have a little article. I think if it's about dentistry, then the Shut Your Mouth and Open Wide is a very good book. And there are some ebooks also on the website just for download.
Lovely, wonderful. Thank you again.
My
Have a
pleasure.
lovely day. Yes. And
And yourself.
yeah,
Thank you. All the
ciao.
best.
Yeah, to you
Bye
as well.
bye.
Bye.